Are you asking, why is my mouth on fire? What is this burning sensation in my mouth? If you're in perimenopause, menopause, or postmenopause and this is happening to you, then you want to watch this video to get some details on burning mouth syndrome. Don't you feel like once we hit a certain age that all we start to ask is like, oh, is this a menopause symptom? Is this a menopause symptom? Am I in perimenopause? Is this what menopause is all about? Burning mouth syndrome was a common condition that I used to see as a dental hygienist 23 years. I'm retired now, so please know this is for information and education only, not medical or dental advice. So if you are over the age of 50, if you are a woman, and if you are in the perimenopause to menopause transition, you may be at higher risk for burning mouth syndrome. Women are way more susceptible than men at a ratio of 7 to 1. Doesn't it seem like women get slammed with everything? If you're over 60, I'm also sorry to say that the prevalence of burning mouth syndrome increases. And if you are a smoker, that can trigger it too. And that's what we're going to talk about. In this video, we're going to talk about what burning mouth syndrome is, what triggers it, and what you might be able to do about it. If you've not met me before, my name is Tanya, and I do get on YouTube here and talk about all things midlife. I like to talk about food from a mindful and flexible perspective and some of the other crap we go through as we age. And yes, I have a series on mouth issues from my experience as a dental hygienist. So if you want to talk about all these things, hit the subscribe button, send me a comment down below of anything you'd like to talk about. We can hang out. Okay, burning mouth. It is exactly what it sounds like. It is burning in your mouth. You may be feeling that right now. You may feel like there is a scalding pain in your mouth. It might be in a certain spot. It can also feel like tingling that just doesn't go away. It actually really hurts, and it can come on suddenly or gradually. Fun! This characterization of a burning sensation can affect anywhere in the mouth. Typically, I used to see it on the sides of the tongue, the tip of the tongue, but you can get it on the gums, on the lips, and even in the back of the throat. And the crappy part about all this is that the tissues look okay. So women may go to the doctor, the dentist, the dental hygienist, and someone looks at them and says, I don't see anything. And they're right, we don't. So what we would first do is an oral cancer screening. Hopefully you're getting that at every checkup. You should be getting an oral cancer screening at your regular cleanings. We want to make sure that there's nothing else going on in there, right? Second, even though we can't see anything, this does require further investigation. So hopefully someone has asked you when it happens. Does a food trigger it? Is there stress in your life? When did it start? Are you in menopause? And this is where a referral to a specialist can come in real handy. There's lots of specialists that deal with oral conditions and even neuropathy, because this can also be a nervous system issue. Hopefully they're going to give you some of the suggestions that I'm going to give you at the end of the video so that you can feel a little bit better with the tissues in your mouth, because this can really bother some people and they have trouble eating. There's a few ways of classifying what burning mouth is: primary and secondary. So primary is there's no cause. It's called idiopathic. It just happens. Secondary means that there's something underlying the burning mouth. It's not just a burning mouth without all other things going on in the body. There's also classifications of type 1, type 2, and type 3. So type 1 is nutritional status. Could you have nutritional deficiencies? 2 is related to mental health or anxiety, and type 3 could be a possible sensitivity or allergy to food or another structure in your mouth. If you wear dentures, if you have braces, if you have an implant, a crown, fillings, even the nice little bonded retainer that I have behind the tongue drives me nuts still. That can be part of that type 3 classification. Suffice to say, by now, you're probably guessing there's a lot of factors that can trigger burning mouth syndrome. And yes, we're going to talk about them. Having a chronic illness can trigger burning mouth syndrome. I know, as if you don't have enough to deal with a chronic illness, you end up with burning mouth syndrome. It's not fair. Things like Sjogren's syndrome can cause a burning mouth, but there's also diabetes. There's a nervous system connection to diabetes. Parkinson's, any neuropathic illness can trigger burning mouth. There's also GERD, gastroesophageal reflux disease, that can trigger burning mouth. It's commonly known as reflux, acid reflux, but that can also trigger it. Not getting enough nutrients can trigger burning mouth. And if you want to have a little more in-depth video on that, pop a comment below. But we're talking iron and zinc and lots of different B vitamins, including folate, which has been linked to burning mouth syndrome. Even sometimes aphthous ulcers, those little canker sores that you get in your mouth, those may also have a little bit of nutrition deficiency component. Then there's oral conditions. We can have candida in the mouth or oral candidiasis, much like babies get oral thrush. When we have salivary changes or other changes in the body, we can get candida in the mouth. This can trigger burning mouth. Even a link to bacterial infections like H. pylori, which can start in the stomach. Now, I mentioned things like dentures or an implant or a crown that can cause or trigger a burning mouth in the tissue, but so can a broken tooth, because that's a constant irritant as well. In fact, any kind of irritation can trigger that feeling. So if you are a cheek chewer, a lip biter, a lip sucker, even if you grind, your cheeks can get caught in between your teeth. That can trigger burning. So you want to address those things. Now, a really big one is dry mouth. There are so many changes that happen in the mouth as we age, in the gut. We take medications. A lot of these things can cause dry mouth. And the lack of saliva itself can be a trigger. This is where the hormonal connection comes in, because we have lower estrogen as we age. We have estrogen receptors in the mouth. And so as the estrogen goes down, sometimes the moisture goes down. I can't remember what video I made on here that said we can have dry mouth and then get dry down south. It's true. These mucous membrane tissues get dry. That can be another factor. Now, I mentioned foods, right? Dietary issues can be a trigger, sensitivities, allergies, but this can also come with oral care products. They can trigger burning in the mouth. In fact, so many things when you think about it that can come in contact with those oral tissues. There could be dyes, sometimes flavorings. Someone has even said fragrances in something that I read. How do we get fragrance in our mouth? Maybe I don't want to know. There are so many links and symptoms with burning mouth syndrome. I'm sorry, it's really quite huge. You can have altered taste, but you can also have this link to stress and anxiety, gut issues, thyroid issues. That doesn't mean that just because you have a digestive issue or a thyroid issue that you're going to get burning mouth. It just means that there has been research that sees people with gut issues or thyroid issues having more incidence of burning mouth. There's honestly so many links and what we call comorbidities to mention. And I know that trying to figure this out can be really frustrating for people because it's something that we can't see. There's also no specific tests for burning mouth syndrome. It really is a combination of seeing a licensed healthcare professional, having them take a history of your symptoms, when it started, where it's located in the mouth, and then sending you off to somebody that they can refer you to if they can't help you themselves to track this even further. It sounds so convoluted, right? So what can you do if you think you have burning mouth syndrome? The first thing that you're going to do, I've already said it, please seek help from a licensed dentist, doctor, dental hygienist, a professional that can help you with this. Because when you see a dentist or hygienist, they're going to do all the things I mentioned. They're going to help you figure out what triggers it. Can we pinpoint a pattern? But your doctor may also be able to find an underlying health condition that could be the trigger to the burning mouth. There's certain medications that can trigger burning mouth syndrome. There's like hundreds of medications that dry the mouth, but there are some that can be specifically linked to burning mouth. So please don't go off your medications. These could be hypertensives. You don't want to go off any heart medication. You don't want to go off any medication until you talk to your doctor, but there can be a link. One of the things that can be done for burning mouth is giving medication. Now, I don't want to talk about that because I am retired. I'm not registered. That's something you will discuss with your health professional. The only thing I'll touch on is HRT, hormone replacement therapy. So if you are having this burning sensation because of hormones, one of the things you can do is go on hormone replacement therapy if it's for you. And that's the thing, we're all individual. There's a lot that goes into making these choices of whether or not hormone replacement therapy is right for you. Some women are scared of it, and some women, they say it's changed their lives. Got to do what's right for you. This is something really simple you can do. If you think this is food related, track your food. Track your food. Track what you eat and when you get burning. Track the time of day that you get burning. I had a woman who tracked, and she figured out that she got burning mouth between coffee, wine, nuts, and wheat. And I thought that was interesting because those four foods can actually carry molds and mycotoxins, which can trigger responses in the body. A little side note, I thought that was interesting. But other women say that it's soda pop, the carbonation does it for them, or acidic foods and beverages. Tomatoes also were a really big one, and strawberries. Funny enough, those two can also cause these oral allergy type symptoms too. And while you're tracking your food, track your oral products, okay? Track the mouthwash, ditch the alcohol mouthwash, the toothpastes with foaming agents, sodium lauryl sulfate, sodium lauryl sulfate. those can be seriously irritating, not just to someone in menopause, but to someone who has delicate tissue. That sodium lauryl or lauric sulfate can actually penetrate your tissue, and the tissue in your mouth is like skin. It's delicate, and we strip away oils when we use certain products on our skin. The same thing can happen in the mouth. So you may want to switch out products, and that's where the all-natural toothpaste, the all-natural, yes, they may be fluoride-free. That's another video. That might be helpful to you because you're getting away some of the harsh things that come in contact with your tissues. Oh gosh, do I wish I put this at the very beginning of this list of tips? Make sure you're hydrated. You can't make saliva unless you're hydrated. Drink. And in a second, we're going to talk about what you can drink that might actually calm your tissues. But I want to touch on a supplement that has some scientific evidence behind helping your burning mouth, and that's alpha lipoic acid, or ALA. This is a fatty acid that is a huge antioxidant in the body, but this article says that it can support nerves and nerve repair, which is kind of cool. So there is some evidence in using this particular supplement. Soothing foods or drinks, sometimes lozenges. People report that lozenges help them. Use xylitol. You keep xylitol away from your pets though, because it's really toxic. Not toxic to humans though. Xylitol can stimulate saliva and have a positive effect on mouth bacteria. It doesn't feed mouth bacteria. So that's one thing that you can do. Sometimes just cold drinks help. Maybe it is the hydration, but you can look to things like chamomile tea. This study actually looked at how holding chamomile tea helped women with burning mouth. Isn't that cool? There are some calming properties in the herb. And you could also use ginger. Now this seems counterintuitive, just like the fact that you can use chili pepper rinses and capsaicin capsules. Apparently they desensitize the nerves, but ginger may have a benefit when it comes to burning mouth. I have a video that you can watch that talks about all the benefits of ginger, breaking up biofilm, helping with your oral health, but even your gut. And I make a simple ginger tea. If you're going to make this for a burning mouth, a delicate mouth, you want to cut back on the ginger, start really dilute, and do not add any lemon. Last couple of things is that sometimes you can go for low-level laser therapy at the dentist or the dental hygienist. Lasers help with inflammation and pain. There's a lot to the laser therapy that might be able to help you, but not everybody can access that. Geez, it's expensive to go to the dentist. Oh boy, I think this is one of the more difficult menopause symptoms that many women go through. And if you have this, I hope you get some help. I hope this video at least was informative. If you would like more oral health videos, pop a comment on any of my videos. I think they're really wide ranging, from the emotional stuff we go through as we age to the physical. And oral health is part of it. You need to be able to chew to help your digestion and enjoy your food, because that's what I'm all about here. Flexible, enjoyable eating too. So that's it for today. I really hope to see you in the next video. If you got this far, thank you so much. Take care.